Hello, this is Dr. Eric Bricker, Medical Director for Coupe Health, and I'm here today to talk with you about how Coupe Health measures doctor, hospital, and medical facility quality and cost. So Coupe Health does that through 4 levels of assessment, and I'm going to go through those 4 levels now. So level 1 is where we review the doctor, and we review them for their board certification and then also for outcomes like their mortality rates, their hospitalization rates, their readmission rates, and their complication rates. Now, we risk adjust those measurements, which is a fancy way of saying that, look, some doctors just treat a lot sicker patients. And so we shouldn't penalize them because they just happen to treat sicker patients. So if you risk adjust for the patient's sort of level of sickness, that gives you a better apples to apples comparison among, let's say, Dr. A, Dr. B, and Dr. C. Now, Coupe Health also reviews their residency location and also looks to see if they've had any malpractice suits in their past. And with that quality data, we then put the physicians into different percentiles against their peers. So you have like the top 10 percentile versus their peers. Then you have the next highest 10%. Then you have the next highest 10%. And so that's level 1. Now, level 2 is similar, except it's for the hospital and the medical facilities, where we're assessing those facilities by specific clinical department, meaning like the cardiology department, the surgery department, the OBGYN department. And so we assess them also on their risk-adjusted complication rates, readmission rates, mortality rates as well. And it's important to look at level 1 and level 2 because you want to have a great physician who's also practicing at a hospital department that has high quality as well. Now, level 3 pertains to the patient experience. So there's actually a survey called the Hospital Consumer Assessment of Healthcare Provider and Systems. It's a patient survey that's sent out to patients after their care that gives them an opportunity to rate their care. And we have gathered in that data along with information from other third-party sources such as Vitals and Healthgrades, so we also get direct patient feedback as well. So that way we get a better judge in terms of the relationship and the interaction between the doctor and the patients themselves. And then finally, for level 4 is a cost effectiveness measure, because some hospitals charge 2, 3, 5, even 10 times more than the hospitals right around them for the exact same service. And there's really no justification for that. So we want to make our members aware of those huge outlier hospitals in terms of charging those very different prices for the same service. So there you have it, the 4 levels that we use to assess doctor, hospital, and medical facility quality and cost effectiveness here at Coupe Health. Thank you for watching.